Difference, not disorder. Hello, my name's Kath Norton. I'm a children's doctor and I also work for the Together for Children and Young People programme. Under this programme, we're working with lots of different people with the goal of improving the emotional well-being and mental health support that is available to children and young people in Wales. I'm going to talk to you about one of the areas of the programme, the support for children and young people who have neurodevelopmental conditions. Now, the most well-known neurodevelopmental condition is autism, closely followed by ADHD or attention deficit hyperactivity disorder. But they also include other conditions with differences around the way in which you learn, you talk, how you communicate, or how you move your body. Now, they're called neurodevelopmental conditions because they're differences in your development. They're not illnesses, they're not diseases. They tend to be lifelong differences, and they're not suddenly cured, although they may well respond to interventions. They're also referred to as disorders or as conditions because it's recognised that they affect the way in which a person functions to a lesser or a greater degree. There's a huge range. But this could be seen as different from what's considered normal. Of course, that does depend on what you see normal as being. Now, many people affected by these differences prefer to use the term neurodiverse or neurodivergent. They don't find the term disorder or the idea of not normal particularly helpful. So perhaps you use the terminology that you feel comfortable with. We want to start a conversation that could see Wales take a different approach to its support for children and young people who've got these different neurodevelopmental conditions. The idea being to give support that focuses on their needs rather than on a single diagnosis or label. And I'd like to explain why we want to have this conversation. The ideas I'm going to share are backed up by academic research and, more importantly, by the lived experience of parents, carers, children, young people and professionals working in this area. So here is a little of what we've seen, heard and been told. The first point we're going to make is that neurodevelopmental conditions are really quite common. They're not rare. Autism, perhaps the most well known, affects 1%, that's 1 in 100 of the population. But the other areas of neurodevelopmental conditions are in fact more common. And we think that if you add them all up together, we could be talking about 1 in 5 or 20% of the population. That's a lot of people. Now, the other thing that we've learned is that although we've got nice separate diagnostic terms, actually there's a huge amount of overlap between these neurodevelopmental conditions, and this overlap occurs in different ways. Firstly, we've become increasingly aware in recent years that you can have more than one of these different diagnoses. Secondly, it becomes apparent that when you look at how the diagnoses are made, that some of the symptoms on which they're based occur in more than one condition. Thirdly, the different conditions can be more or less obvious at different stages of your life. This is probably because the demands that you experience, the circumstances in which you're living, change over time. So let's talk about embracing this complexity of presentation and getting a better understanding of neurodiversity and what this actually means for us as individuals, but also for how we provide services. Now, I'm sure that you'll have heard the term autism spectrum or heard people casually say that they've got a trait of autism or a bit of ADHD. Now, this is probably because we know these conditions fall along a scale, a continuum. By that we mean that in a typical group of people, there will be some who have little or no traits, some who have a lot, and most people fall somewhere in the middle. Now, the skill of making a diagnosis is finding that point at which somebody meets the preset rules, the criteria for that diagnosis, finding the cut-off point. Now, that's quite challenging and it's often controversial, but it becomes particularly problematic if you look at the continuum, because you cannot avoid the fact that there will always be people who have some needs and some symptoms but will fall below that cut-off point. And that becomes very relevant if diagnosis is used as the way to unlock resource or support, or where diagnosis is the only language that you have to communicate and to describe those needs. So why is all of this important? Well, we're concerned that the current system is not delivering what people need. And this is evidenced by concerns that we're hearing on a regular basis around access to education, exclusion from education, attainment, family functioning, emotional health and well-being, and ultimately what your lifetime outcomes are if you are neurodiverse. I think I've talked for long enough now. Are you ready to start the conversation? What do we need to do now to share a better understanding of what being neurodiverse means for children and young people growing up in Wales today? Is there a way that we can embrace the complexity that we've discussed without making it overcomplicated? Identify, recognise and support a range of needs at an earlier stage? Develop a common language and resources and ways to communicate what being neurodiverse means and how we can help. Improve access to the pathways for specialist assessment and intervention where that's required. But use diagnosis where a diagnosis is needed, not as a way to gatekeep and control resource. If this affects 1 in 5 of the population, we've really got to pull together as a team across all sectors. Together, we've got a chance to find a new approach to the way we support children and young people that focuses on their needs rather than a diagnosis. An approach that celebrates differences rather than focusing on disorders. Thank you for listening. If you've got questions, please continue the conversation and link in with us at Together for Children and Young People.